The argument came down to like, basically, does using the information that a SPECT scan supplies, does it actually improve clinical outcomes compared to standard treatment? Like, does using it actually improve clinical outcomes? And do we have the randomized data to know that? And essentially, well, no, we don't. And then, so it kind of positioned this argument of like, I think it's helpful to delineate between like a coaching compliance motivational tool versus like a clinically meaningful. Homocysteine is a great example of a really clinically meaningful biomarker. We know the technology, we know what it is, we know that high levels are bad and are implicated in cardiometabolic, neurodegenerative, all the things. We know it's modifiable. We know if we give B vitamins, it'll lower it, right? Versus, some other data point or functional test that we may not really have that level of clinical validation. But you know what? Like a urinary neurotransmitter test would be a great example. It doesn't have established clinical utility for mental health disorders. But if that test motivates the client to like listen to you and apply themselves to the protocol and the program, then, absolutely, right? Because I would agree with that logic, right? Of, oh, well, if I, fix the gut, it would decrease the food sensitivities. But then it kind of just becomes this subjective of like, well, what's the preference or what's catered to the psychological benefit of the client or the patient, which is ultimately what we as the practitioners should be primarily focused on. And that will be highly subjective, right?